Have you noticed that something which once felt natural and effortless in your younger years now feels different, quieter, less responsive, maybe even confusing? Many men over 60 tell me they don't quite recognize their own bodies anymore. The sensations are subtler, the timing has changed, and with that change often comes a silent question. Is this just aging, or is something wrong with me? I'm Dr. James, and for more than 3 decades I've worked closely with men in their 60s, 70s, and beyond, helping them understand the changes that come with time rather than fear them. What you're experiencing is far more common than you think. Many men continue old habits without realizing that their nervous system, hormones, and circulation no longer respond the same way they once did. In this video, I'll explain why these shifts happen and how to adjust in a way that restores confidence, comfort, and connection with your own body. And there is one subtle mistake, one that almost every older man makes without noticing. That may be quietly shaping how you feel today. 1. When habit becomes harm, the hidden cost of mindless stimulation. After 60. If you're a man in your 60s or 70s, living through retirement, managing blood pressure, maybe taking a statin or two, you've probably noticed that your body doesn't respond the way it once did. What used to feel automatic now requires more effort. Many men don't talk about it, but they quietly wonder whether the fading sensation or inconsistent firmness means something is permanently broken. In reality, one of the most overlooked causes isn't age alone, it's habit. For decades, you may have approached self-stimulation the same way, quickly, privately, without much awareness. In your 30s or 40s, your nervous system was resilient. After 60, however, the brain becomes more conditioned by repetition. When stimulation is rushed, mechanical, or always done the exact same way, your brain learns to respond only to that narrow pattern. Over time, sensitivity decreases. You may find you need more pressure, more intensity, or more specific cues just to feel what once came naturally. That can quietly fuel anxiety. Why doesn't my body respond like it used to? And that anxiety itself further disrupts blood flow and arousal. If this pattern continues unchecked, it can contribute to delayed response, weaker erections, or frustration that spills into your confidence and relationships. The good news is that the nervous system remains adaptable, even in your 70s. Slowing down, reducing intensity, focusing on breath and full body sensation rather than outcome, these small shifts retrain the brain. This isn't about giving something up, it's about relearning your body in this season of life. And that brings us to something just as important. What happens when a man decides to stop altogether? 2. The silent consequence of stopping completely: prostate congestion and hidden inflammation. And just as retraining the nervous system matters, there's another quiet pattern I see often in men over 60, the decision to stop altogether. Many American men in their late 60s or 70s, especially those who are widowed, divorced, or simply no longer sexually active, assume that shutting down this part of life is the appropriate next step. It can feel dignified, even disciplined, but biologically, your body does not interpret it that way. Your prostate continues to produce fluid regardless of relationship status or age. When ejaculation becomes rare or stops for long stretches, that fluid can accumulate, contributing to pelvic pressure, urinary urgency, getting up multiple times at night, or a weak stream. For men already managing benign prostatic hyperplasia, or BPH, this can quietly intensify symptoms. The fear that often follows is deeper than inconvenience. It's the unspoken worry about prostate cancer, surgery, catheters, or losing control over your own body. Now, abstinence in itself does not cause cancer, and there are seasons, after certain surgeries, infections, or under specific medical guidance, when temporary rest is appropriate. But for many otherwise stable men, complete long-term suppression may contribute to congestion and a more inflammatory environment. What I advise is moderation, not excess and not elimination. Gentle, periodic release, without strain or pressure, can support prostate drainage and comfort. If you've been waking up multiple times at night or feeling that dull pelvic heaviness, this may be a factor worth discussing with your physician. Because as we move forward, we also need to address something less physical but just as powerful: the emotional weight many men carry that makes them believe they should not be engaging at all. 3. The hidden burden of shame. How guilt undermines mental and physical health. After 60. As we consider the physical side of prostate health, we also need to look at something less visible, but just as influential: shame. Many men now in their 60s, 70s, and beyond were raised in households, churches, or communities where self-touch was labeled inappropriate or morally wrong. Even if your rational mind has moved on, those early messages often remain stored deep in the nervous system. You may not consciously think, "This is wrong," yet you still feel a quiet tension, a tightening in your chest, or a subtle urge to hide. For older men already navigating retirement, changes in identity, or the loss of a spouse, that internalized guilt can compound feelings of isolation. I've sat with men who told me they stopped engaging with their bodies, not because they lacked desire, but because they believed it was no longer acceptable at their age. Over time, that emotional suppression can elevate stress hormones like cortisol, disrupt sleep, worsen blood pressure, and contribute to low mood. The fear that follows is rarely about sexuality itself. It's about losing vitality, becoming invisible, or feeling disconnected from who you once were. It's important to clarify that this is not about dismissing personal values. If a man chooses abstinence for spiritual or personal reasons, that is his right. The concern arises when avoidance is driven by shame rather than choice. The action step here is simple but powerful. Examine your beliefs. Ask yourself whether your hesitation comes from conviction or from inherited guilt. Reducing shame, even privately through honest reflection or conversation with a trusted healthcare provider, can lower stress and restore a sense of wholeness. And as we move forward, we must understand how this emotional disconnection can quietly influence something even more measurable: your testosterone levels. 4. Testosterone is not just about age, it responds to engagement. When we talk about emotional disconnection, we also have to talk about hormones, especially testosterone. Many men in their 60s and 70s assume that declining energy, reduced drive, loss of muscle tone, and fading motivation are simply the unavoidable price of getting older. In part, aging does lower testosterone, but what often goes unspoken is that lifestyle and sexual disengagement can accelerate that decline. In my practice here in the United States, I see men who are managing diabetes, heart disease, or weight gain, and they quietly wonder why they feel less like themselves. They describe fatigue that doesn't improve with sleep, a loss of confidence, or a sense that their edge is gone. When sexual activity, partnered or solo, drops to zero for extended periods, the brain receives fewer signals to maintain robust hormonal output. The body adapts to perceived inactivity. Over time, that can influence mood, muscle mass, bone density, and even cardiovascular health. This does not mean every man needs frequent stimulation, nor does it apply during recovery from surgery, acute illness, or when a physician has advised temporary restriction. But for otherwise stable older men, complete withdrawal can contribute to a cycle of lower testosterone and lower vitality. The fear many carry is deeper than numbers on a lab report. It's the fear of becoming weak, dependent, or no longer capable. The action step is measured and responsible. If you notice persistent fatigue, depressed mood, or physical decline, speak with your primary care doctor about checking hormone levels. At the same time, consider gentle, healthy engagement with your body as one part of a broader strategy that includes strength training, sleep, and balanced nutrition. Because beyond hormones, there is another system that depends on regular engagement, and that is your vascular health, particularly erectile function. 5. Erectile function is a use it or lose it system. As we shift from hormones to circulation, we need to speak honestly about erections, not as a symbol of masculinity, but as a marker of vascular health. Many men in their late 60s and 70s tell me, "I'm not dating anymore, so it doesn't matter." What they don't always realize is that erectile function reflects blood vessel flexibility, nerve signaling, and nitric oxide activity. It is, in many ways, an early window into cardiovascular well-being. When erections become infrequent over long periods, not because of illness, but because of disengagement, the penile tissues can gradually lose elasticity. Oxygenation decreases, smooth muscle tone weakens, and small blood vessels become less responsive. This is not an overnight change. It happens quietly, which is why so many men are caught off guard when they later decide they want intimacy again and find their body no longer responds the way they expected. The unspoken fear then becomes, is this permanent? Is this the beginning of a bigger decline? To be clear, there are situations where temporary reduction is appropriate, such as after certain surgeries or under direct medical instruction. But for otherwise stable men, allowing the system to remain inactive for years can contribute to functional decline. The consequence isn't only sexual frustration, it can erode confidence, strain future relationships, and sometimes signal broader vascular issues that deserve medical attention. The action step is not performance pressure, it is maintenance. Regular, gentle erections, whether through natural arousal or self-stimulation, help maintain blood flow and tissue health. If you notice consistent difficulty, discuss it with your physician. Erectile changes can be an early indicator of heart disease or diabetes. And as we consider blood flow, we must also examine something that increasingly interferes with natural arousal in modern life: the overstimulation of the brain through digital content. 6. Digital overstimulation and the aging brain, reclaiming natural response. As we talk about blood flow and vascular health, we also have to address what is happening above the neck. Many men over 60 in today's world have access to digital stimulation that simply did not exist in their youth. What may begin as occasional viewing out of curiosity, loneliness, or habit can gradually become the primary trigger for arousal. The brain, even in older age, is highly adaptable. It learns quickly, and sometimes in ways that work against you. When the brain is repeatedly exposed to high-intensity, fast-changing visual stimulation, it releases dopamine in large bursts. Over time, this can reduce sensitivity to more subtle, real-world cues. Men then notice something unsettling. They respond to a screen but struggle with natural touch or imagination. The fear that follows is deeply personal. Is this permanent? Have I damaged something? That anxiety alone can further impair arousal and confidence. This does not apply to every man, nor is occasional use automatically harmful. The issue arises when digital content becomes the only reliable pathway to stimulation. In those cases, the nervous system can become conditioned to intensity rather than connection. The consequence may include reduced sensitivity, delayed response, or difficulty sustaining arousal without visual input. The action step is gradual recalibration. Consider taking intentional breaks from digital stimulation and allowing your brain to reconnect with slower, less intense sensory experiences. Focus on breath, physical sensation, and presence rather than visual triggers. The brain retains neuroplasticity well into your 70s and beyond. It can relearn. And as important as retraining the brain is, we now need to look at something even more profound: the role of human touch and the risk of isolation in later life. 7. The most dangerous mistake: emotional and physical isolation. As we move beyond brain chemistry and circulation, we come to what I believe is the most powerful factor of all: isolation. Many men in their 60s, 70s, and 80s are living alone for the first time in decades. A spouse may have passed, children have moved away, retirement has reshaped daily structure. In that quiet, physical touch often becomes rare, not just sexual touch, but any touch at all. Over time, the body and brain begin to register that absence. Human physiology does not outgrow the need for connection. Touch stimulates oxytocin, lowers stress hormones, supports immune function, and stabilizes mood. When a man stops touching and being touched, whether out of grief, embarrassment, or the belief that he is too old for that part of life, the nervous system can shift into a subtle state of withdrawal. Sleep may become lighter, blood pressure harder to control, mood more fragile. The fear beneath it is rarely spoken aloud. It is the fear of fading, of becoming irrelevant, of losing the sense of being fully alive. This does not mean every man must pursue a relationship, nor does it dismiss personal choice or circumstance. But complete emotional and physical shutdown carries consequences. Isolation has been linked in medical research to increased risk of depression, cardiovascular disease, and even earlier mortality. The body interprets prolonged disconnection as a stress state. The action step begins gently. Maintain some form of physical connection through self-care, safe intimacy, massage therapy, or even meaningful social contact. Stay engaged with your body rather than abandoning it, because at this stage of life, preserving vitality is not about chasing youth. It is about refusing to disappear. And that brings us to the most important message of all: how to move forward with balance, dignity, and renewed confidence. 8. Conclusion: protecting vitality with awareness, not fear. As we step back and look at the full picture, what this conversation has truly been about is not performance and not youth. It is about stewardship. After 60, the male body becomes more sensitive to patterns. The nervous system adapts more quickly, blood vessels lose flexibility more easily, hormones fluctuate with less resilience. Small habits, repeated daily, can either support long-term vitality or quietly erode it. Many of the risks we discussed do not appear dramatically. They show up subtly: lighter sleep, more nighttime bathroom trips, slower response, fading confidence, a sense of emotional withdrawal. During sleep especially, your body performs critical repair work, regulating hormones, restoring vascular tone, calming inflammation. When stress, shame, inactivity, or overstimulation disrupt that rhythm, the consequences accumulate silently. Understanding this stage of life means accepting both its fragility and its potential. The body is more vulnerable, yes, but it is also still adaptable. When you slow down, reduce extremes, maintain healthy circulation, and remain emotionally engaged with yourself and others, you are sending a signal to your biology: stay active, stay responsive, stay alive. The next 1 to 5 years matter more than most men realize. Patterns established now will shape your cardiovascular health, cognitive sharpness, hormonal balance, and independence well into your 70s and 80s. Waiting until a problem becomes severe often means facing medications, procedures, or limitations that might have been delayed or softened with earlier adjustment. This is not about fear, it is about informed choice. By understanding how your body changes and responding with intention rather than avoidance, you protect not only function, but identity. Aging does not mean disappearing. It means learning how to care for a body that now requires wisdom instead of force, and that wisdom begins with awareness. If this conversation spoke to you in a personal way, I encourage you not to keep it to yourself. Many men over 60 are carrying the same silent questions, the same private concerns, and they may never ask unless someone else opens the door first. If you found value here, please take a moment to like this video so more men can see it. Share it with a friend, a brother, or someone who might benefit from an honest, respectful discussion about aging well. I also invite you to leave a comment below. Your experiences and reflections truly matter, and they help guide future topics. And if you haven't already, subscribe to the channel and turn on notifications so you won't miss upcoming videos designed specifically for men navigating this stage of life with strength, clarity, and dignity.